parents, teachers, and all the well-wishers. Welcome back. Today, I'm going to talk about our health, your health and my health. Especially this season change, we call it. And now, because of cyclone, most of Andhra and Telangana and some parts of India and also world experiencing heavy rainfall. When there is so much rain, heavy rainfall, immediately the first sickness is waterborne sickness, waterborne infections. I want to speak about this, very important, because I insist my students to have water, at least 8 to 10 glasses of water. We all know that, we believe, and we are doing it. What kind of water are we drinking? Do you have the access to clear drinking water? Because this rainy season, first of all, most of our groundwater gets polluted. If any of the areas are trying to drink groundwater directly without any kind of purification, they are the first one to get these infections. That's why, what kind of water we drink? My simple suggestion to my students, my parents, my teachers and well-wishers, whatever the water you get, either through municipality taps or you have direct groundwater, bore water, bore well, or packeted water, the packeted cans. I'll speak about it also. But whatever the water, I tell you, treat the water, not with the chemicals. Simple task, but definitely for the whole family, it takes little time. Boil your water. Boil the water at 100 degrees Celsius, at least for a couple of minutes. Then cool. After it comes to the room temperature, start drinking that water. I tell you, whatever the season may be, however the rainfall may be, whatever the pollutants add to our groundwater will not affect us, will not harm us. We will not fall to these waterborne infections, cold, cough, viral infections, fever, stomach infections. We will not. Take this small precautionary measure, and at the same time, it is our health and it is in our hands. We should take care of it. Thanks to St. John's, because from last 10 to 15 years, we do have our RO plant, reverse osmosis plant, where we treat our groundwater and we provide this RO processed water to the whole school, all the students, all the teachers, all the helpers, and also nearby community people also will come and fill those from our tanks and then go. We take utmost care in treating this water and providing clean water for all our students in the campus. Thanks to our correspondent sir, who has this wonderful gesture way back 10 to 15 years, we are privileged to drink such water. At this point, I want to bring one small thing, one note to all my viewers. Once, when one of our well-wishers passing through, they saw a big truck, a mini trucks where water cans are supplied home. The truck was parked next to a bore well at one corner of a street and they were filling the water cans directly from that bore well and putting the caps and supplying to the homes. It happens, you might have also come across, playing with the lives of small children, adults, old people, sick people. It's better you drink the borewell water directly, but why to just fill those cans? Pretend that they are purified, pretend that they are treated water and supply to the residential areas. My dear students, my dear parents, teachers, my dear St. John's community, this season where most of the people are suffering with waterborne infections, I want all of you to look around, check the authenticity of this water supplier who brings water to your home. I don't generalize. Kindly be specific. Check the authenticity. Check how they are treated. Or it is better, good, that you boil the water and you drink the water after boiling it. That is the first step for us to take care in the season of heavy rainfall. It's easy in our developing country where we have open switch, open drainage system. When there is heavy rainfall, all the waters gets mixed. The water percolates into the deeper layers of the soil, mix with the groundwater, and groundwater is getting polluted. Is it not our responsibility to make sure that what kind of water we drink? It's not always you depend on someone that who get water for you. Try to check on your own. When I look back, WHO and UNICEF working for the whole health of the world. This pandemic, we have seen many of the WHO press meets thanks to COVID. We know them very well. But this WHO and UNICEF has given one alarming statement. Nearly 884 million people don't have the access to the clear drinking water. Don't think somewhere. Just walk out of your house, go to the corners of the street, or go to your town or city where you have the underprivileged, the nomads, the slum areas. Where do they get water from? What kind of water do they drink? How sad. How we can provide is secondary. But at least treat the water, what you drink and what you give to your children. That avoids most of us falling sick. That avoids most of us unnecessarily exposing ourselves to the hospitals, doctors. Already they are tired treating many of the COVID cases. The small ailments, you want to go disturb the doctors? Take care of yourself. Small headache, that too this generation, they're so much dependent on the medicine, on the tablets. My dear parents, I discourage my students. When you have severe headache, instead of taking one tablet, why don't you just drink some water, eat some fruit or eat some good food, relax, take some rest 1 hour, headache will vanish. For that you want to take a tablet? Dump your body with some medicine. Any medicine is poison to the body unless to that particular ailment. Is it not? Any drug, anything. Our natural body working system we disturb. Let us start taking care of ourselves by putting an extra effort to make sure that we drink clear, clean water during this season of heavy rainfall. Think about this. Take care of yourself. Take care of others. Be blessed. Have a nice day.